不用理他了。
好，直播进行中。
你不要再按哦，再按就结束了。
哎，你看，好棒哦！哦，好开心哦！
我有传给我。
太好了，好。
直播室后面这一支，
他叫我不要改，
哦，
他说不要动。
你直播那个幕可以关掉。
我直播也
right 在等你的技术了。
好，
像我们。
我跟他讲说，其实我应该可以
把那个
I
扩亮
know
的荧幕下来。
I know I'm waiting for your technology。赶快结合一下吧。
对。
对啊，你跟达标两个结合一下。
我看明天能不能先把平板版本先拿过来试看看，对，然后对接一下这个。
明天请到7·1计划区松仁路华南金融大楼2楼，金周刊的活动找我。
So I think the roads will be the last time.
Oh,
really?
Oh, really? You know, can you tell who they are?
YouTube. Ooh, that's good.
Is that where this one is?
Yeah, this one.
DTA YouTube.
他请问大哥有单多少？
可以把它那个连接又出来。
有的，我说，对。
只是我没看到。
你要好，它有一个 QR code 对不对？对。或者你去 YouTube 搜寻 DTA。I guess we can start, right? It's 8.
Yes.
Okay. 可以坐在那边讲哦。
可以啊。
Hi, Sydney.
Hello.
Hi, I think we can start now. Everybody's here. The equipments are all set up.
Wonderful. Okay, perfect.
Thank you.
Fatima, do you want to go ahead?
Good evening, everybody. I'm Fatima, and I'm a member of the MIT Hacking Medicine team. We're incredibly excited to be here today with the Taiwan Digital Transformation Association for a design thinking workshop. Next. Our workshop focuses on culture problems, but the essentials of design thinking can be applied to any problem. Next. So I wanted to introduce myself. I'm Fatima Fowler, and Sydney Sherman and I will be tag teaming, going back and forth between the slides for this presentation. As I mentioned, I've been part of Hacking Medicine for a year now, and I have a background in ophthalmology visual research, as well as ophthalmic clinical device design. Worked in some clinical trials to bring an ophthalmic device to market. And currently I'm working on the hospital experience for metastatic cancer patients. So in all these situations, I've used design thinking.
Good evening, everyone. And I'm part of the Hacking Medicine team as well for about 6 months now. And I'm currently a PhD student at MIT and Harvard Medical School. And I'm working on medical device diagnostics, specifically MRI technology. So through diagnostic device building, I've been involved in 2 very early stage startups. And we're looking to bring some of our devices to market within the next few years. So I have also tried to use the design thinking process that we are going to present today. We are very excited to be with you this evening and tomorrow as well.
All right, so here's one of our most well-known hacks at MIT. I think Michael went over with you the other day about it, but I just wanted to bring it up again because it is a very creative endeavor to get a fire truck on top of a dome. How did the students manage to do it? As well as it didn't take just one day. It took one day to execute it, but it took a year of planning to actually get the truck on top of the dome. And this is what hacking is all about. Next. I'm going to give you a brief background on the MIT Hacking Medicine group, just to give some context. And our mission is to democratize healthcare innovation for all. This includes all of you here today, to empower you to make healthcare better. As many of you think of hacking, you're going to think the first thing that comes to mind is gaining unauthorized access or breakthrough. But in the design thinking methodology, it actually is a creative application of ingenuity. So when we're talking about hacking in this instance, the lack of creative application of ingenuity. Next. And for those of you who have been to hackathons before, I'm going to have everyone mute themselves for just a moment. Okay, so for those of you who have been to hackathons before, MIT Hacking there's this and because it's covered by a lot of design thinking in real time over a weekend. So in our hackathons, you don't need you don't have to code during that weekend. The teams are diverse, and diverse teams are encouraged. If you are like another member in your team, you're redundant. And usually the best teams are filled with different skill sets. And then we work on real pain points. The problem-centered work on real user needs, which make real impacts. And the last thing that we like to emphasize is business viability of the solutions. If you can't create a business, your idea won't scale. The more you can scale, the more you can impact. So business viability are really important. Next. At a glance, you can see throughout the last couple of years, we've been all around the world and have made health hackathons happen, workshops happen, specifically in 29 countries, covering 73 cities. Next. And the hackathon process has come into scrutiny at times because of the rapid ideation process, but when you look at our impact in the healthcare ecosystem, just from MIT Hacking Medicine alone, 45 companies have been started within 7 years. We've gotten 175 million in funding and growing. People go on to Techstars, Y Combinator, for example, and all of these things lead to clinical trials, pilot studies impacting real patients. So we believe that this methodology really does work. So what does a healthcare design workshop look like? I talked a lot about a hackathon, but let's dive into the design process. So what is you might see some stickies and some whiteboards around. This is a creative process, and those tools help you be creative. Design thinking is a creative problem-solving endeavor, and it's an iterative design process. Iterative means that you keep coming back to it. It's not finalized, it's circular, and you keep working on it, making it better. Design thinking has a human-centered core, so it encourages organizations and companies to focus on the people they're created for. So you're going to identify a problem, break it down, brainstorm for solutions, and then iterate and improve. So specifically, the MIT Hacking Medicine methodology is what I just went over, and broken it down into 4 steps, calling it step 0, defining the problem, step 1, breaking it down, step 2, building it up, step 3, making it better. And in step 0, you're defining the problem often with qualitative methods, such as conducting user research. step one, you want to start to ideate and begin thinking about design solutions. In step two, building up the prototypes, mock-ups, storyboards, and iterating quickly throughout those things. And so the last step, making it better, you're going to start to test your prototypes, what does work, what doesn't work, and iterating again. And then using the results from those to iterate again. And you're going to go through a couple of rounds of this. Next slide. I just want to dive in a little bit deeper into some of those steps that I mentioned. So, defining the problem. You're going to research your users, and this is a more complex step than it first appears. This is where you're going to devote a lot of time, because being as specific as you can really helps you hone in what the actual problems are. So you're going to use empathy for a lot of defining the problem. And using empathetic models, you're going to gain an understanding of the user. You're going to conduct interviews, observations. These can be things in a healthcare clinic or interviewing patients to kind of see what pain points they are experiencing. And one of the things you really want to stress at this step is you don't want to start with a great idea or a solution that you think is a great idea to begin with and working around that, making that work. You want to first identify what is an actual problem and creating a solution around that. So a lot of companies will think about idea and just go full steam ahead, but those will not conduct a lot of user research and what things real people feel. And then once you analyze your observations, you can synthesize them, and then you can create personas, challenges, and pain points. So with a persona, when you are presenting your pitch or anything like that, personas help people understand who is going to benefit from this solution. And it's a great exercise to put yourself in other people's shoes. Next. The next step, breaking it down, you're going to ideate, and with that, you're going to challenge your assumptions and create further ideas. So this is where your sticky notes are really going to come in handy, and you're going to generate a lot of ideas, not just one, but create as many of them. And this can be a participatory process. You can include many stakeholders, and with that, you'll gain a broader perspective on the issue. And all ideas are worth it. You want to think outside the box. You want to stretch your mental capacity for what solutions are, what problems and solutions are out there, just so it's informed brainstorming. Next. Step 2 is to prototype and start creating solutions. You're going to start with a scaled down version. This is the experimental phase. You are prototyping to learn, not prototyping the final product. So you can prototype, learn, throw away, reiterate. Low fidelity prototypes are great. Some of the hurdles people come through are trying to create the perfect prototype, which you never have. So that's a major block for some people. So create whatever you can, low fidelity, and keep moving, scale fast, and often. And the last step is to make it better. You're going to try from your prototype what solutions work, because you probably created several prototypes because of the different ideas that you've generated, and you're going to rigorously test all of those. Although this is the final phase, it's iterative, so you're going to keep going back to maybe step 2 or step 1 or step 0 and reevaluating if what you had first proposed is still valid. Next. So, to distill some of that, a good solution is based on a good story, which was some of the personas that we talked about, and meets a real need, can be iterated, can be tested, and can be scaled. And so we went into some of the nitty-gritty about what design thinking is, but why should we use design thinking? And it offers all a human concrete need. So these are needs that have been proven effective because you went out and you did the qualitative research, the user research. And again, it's not going off a great idea, it's going off what people actually need. And then it tackles problems that are ambiguous or difficult to define. So some of these problems you would not have the capacity to think of until you're in the trenches and stuff results. So that's where optimization and interviews come in. This leads to more innovative solutions. It's been shown that companies who use design thinking have been successful and ahead of the curve in many instances. And lastly, it makes organizations run faster and more efficient because this is an efficient process. It's condensed and concise with better results in the end. You're not wasting time or money. If you go in just full steam ahead with a product that you like or think is a great idea, but then does some of that user research, along the line, down the line, at the late stages, you will find those flaws, and then you've wasted millions of dollars. So it's important to identify those in that very early beginning stages.
All right, thank you, Fatima. So Fatima just told us all about the design process and what the main steps are, and we kind of gave some evidence things that does work for early stage startup companies. But as with anything, there's a big difference between the design and coming to a solution and the design or coming to the best or even a better solution. So there's a few key questions that we want to ask ourselves at each stage of the design thinking process, and hundreds of times within each stage, you make each iteration, and that's, is this a good design? So when you put all your sticky notes or you've got all your note papers and different ideas, you can ask all of these questions and see what is a good design supposed to do. So a few key points for good design. You want good design to make our lives easier. If your product is not taking something complex and making it easier, more digestible, better to understand, someone's job gets a little more foolproof, then maybe it's not a good design. So here's a specific example of making our job easier. So on this slide, I have the results of a complete blood count. You go to a physician or you're in the hospital for a treatment, you get a blood test. You need a blood count. So this is the information that the doctor gets at the end. It's a list of metrics and a list of the values. And it does its job. If the doctor needs the values, he has the values, he or she has the values right here. It is functional. But aside from that, what's wrong with it or what can be improved? So one thing, it takes up a lot of space. If somebody's getting a blood tested every 6 hours or for every day, and they're getting this output as a result, that's a lot of paper for the doctor to go through. Another point is that maybe if someone's tired or looking through all these values quickly, it can be very easy to misread one number for another. If you're looking to the left to see what the metric is and then over to the right to get the value, you can misread the numbers. And it doesn't really highlight necessarily if something's wrong. So what are ways we can take a very simple thing, like giving a list of values, and make it better using design thinking? So this slide shows what is commonly used in hospitals to present the same information. We've got the same values, but this time we don't have the metrics they're associated with. Because if you train doctors from the beginning that this is how these values are presented, everything stays in the exact same spot on every one of these bars, it's very easy to look and know chloride is 98. You can always find it right in the middle. We look on this chloride across to 98. You have to go down the list, find where your value is, and then go over to the right to look at it. If everything's in the same spot on these easy graphs, it's a lot harder to be tired and misread one number for another. This also takes up a lot less space if you want to line up 6 of these next to each other and compare. Another thing that is also done is numbers that are outside of a range can be highlighted to draw your eye's attention to it. This is such a simple example. It's really just a list of numbers, but you apply some design thinking to it, say how can we be creative with presenting this simple list of numbers, and you come out with a solution that once doctors are trained on, it's very easy for them to get used to and move forward with. So this is one example of good design thinking making a job easier. What else should good design thinking do? A big one for both the company making the design and anybody buying the design is lowering costs. So here's an example of good design lowering costs. Omada is a company that provides a healthcare platform that employers can use to get all of their employees more healthy. So I know healthcare works differently in all different countries, but in the United States, employers often pay and subsidize health insurance. So if you have 100 employees under you and you're subsidizing all of their health insurance, you really would like them to be healthy. Otherwise, you're paying a lot more. And a lot of people have chronic conditions or need to lose weight. So here's where you want one platform that you can go to where your employees can get the help they need personally, and that in turn reduces the cost of the employer. So this is what the Omada platform offers. It offers changing food habits, increasing activity levels, preparing for challenges, activity challenges, health challenges, and then reinforcing healthy choices. None of these 4 phases or options they have are new. There are dozens of apps and health platforms that a person can enroll in or buy a subscription to get this same information. Well, why is it great that it comes on this particular Omada platform? If the person as an individual can get the help they need through working with clinicians, through getting some information right to their doorstep, through being able to have health coaches available to them, it helps them, but it helps their employer lower health costs. So the employer can buy this platform or subscribe to this platform for all of their employees, and in turn, lower their own costs by keeping their employees a bit healthier. It also is only one platform, so if your employees are all using their individual health apps to pick what their goals are, so maybe someone uses something like Fitbit to track their fitness, and someone else has a different app for managing their diabetes, put it all in one place where the employer can also kind of incentivize people to show their health workout goals or show that they are managing their chronic condition. They can give incentives for it and save on money in the long term by paying less for health plans. So this is an example of design that's not necessarily anything new. There's nothing wildly novel about this idea, but the way they bring it all together ends up lowering costs and makes it very appealing to large employers. So yeah, an idea doesn't necessarily need to be completely out there. It could be really to use good design and to be very effective and desirable as a product. And finally, good design should save lives. In this particular workshop, we're focusing on the healthcare space because as MIT Hacking Medicine, that is where our focus are, or where our focus is. But you can do this in any space as well. It doesn't need to be healthcare. So here's an example using incidences of complications in surgery. So this is from a New England Journal of Medicine research article about the incidence of complications in surgeries in global populations. So there's about an 11% chance of any complication happening, and then a 1.5% chance of death with any surgery. So what the World Health Organization did is they put out a simple checklist. 1 page and three boxes, a few simple questions. And they let you know when you should complete each checkbox before putting the patient under anesthesia, before actually making an incision, and then before the patient leaves the operating room. The questions are about the patient personally. Do you have the right patient? Do you know if they have a specific allergy? Then confirming that all the team members within the operating room know themselves. If you need your anesthesiologist, do you know which person you want to look to? Or do you need a nurse to hand you something? Do you know who's the nurse in the room and everybody's wearing scrubs and has their caps on? And then finally, at the end of a surgery, you have all the instruments back on your table and make sure that none are still in the patient when you sew them up. Have the specimens you removed from the patient been labeled properly? All of these questions individually you think would be second nature to doctors. None of them are new. They're all probably thinking of them in the back of their head. But it's a very stressful time for them. They're under a lot of pressure. So putting out that information on this very simple chart has actually shown to decrease the risk of complications and deaths. And back to it. There's nothing new about this checklist. They're not teaching the doctors new information. They're not asking them for any information they're not already getting. They're just making sure that the doctor is mentally checked off each of these boxes and that some basic things are taken care of. And that little bit of design thinking can reduce the rate of complications and death in surgery. So all three of those examples, we've seen the blood values, the healthcare platform, the surgery survey, they're all taking what could be complex systems and they're making them look simple. So good design is taking a complex system and breaking it down and presenting it back in a way that's very easy to digest. And that ties back into our four-step design thinking process.
Thanks, Sydney, for going into those. Now let's look at another case study in action, and this is an idea that came out of the first MIT Hacking Medicine hackathon. And this case is about the company PillPack. Let me tell you a little bit about PillPack. So the landscape PillPack is trying to address is the prescription drug adherence landscape. So adherence as in how many people take the medications that they're supposed to at the scheduled time that they're supposed to. And as you know, when patients don't adhere to their medication schedules or regimens, it can be detrimental to their health. So this is a big problem. And there's, from their user research, they've found that 34 million people in the US take prescription drugs. And out of those, 50% are non-compliant. So from that, they found that this resulted in 700,000 unnecessary hospital readmissions, which is costly to the healthcare system, totaling about 180 billion extra costs. And when you look at this patient micro viewpoint to the macro, the entire healthcare system, we see how everything's interrelated. We can make how your solutions can make an impact on the bigger system. Next. So we're going to go through all of the points, and we're going to break down their story, how to hack. So let's start with identifying the problem, step 0. Next. Their pain point was that patients want their symptoms to be under control, but they have other priorities in life, such as work and family, over managing medication. So putting other people ahead of themselves. And specifically, PillPack is focused on a subgroup of patients, working age adults who are taking multiple prescriptions. So with that extra knowledge, we're going to have to create a solution for that age range and people who are taking multiple prescriptions, not just one. And this problem is large, and there's many factors that contribute to this, but mainly it was prioritizing work and family. And now we're going to break it down. Now that we've identified the problem, we're going to go on to the next step, which is to start thinking about who matters in this equation. Next step. So when you break it down to see who is a player in this landscape, the prescription drug adherence, you're going to think about the users who are missing their medication. You're going to think about other stakeholders who are affected by the patients not taking their medications. And then you're going to also think about the payers of the medication. It could be the user or it could be other payers, such as the employer, the government healthcare system, and what are they doing. Next. So when you look at it in this view, you can see that this is right for putting sticky notes and kind of like a sticky note for patient, a sticky note for family caregiver. Having it in this like at a glance view kind of helps you see the bigger picture. So once you identify, for a POPAC, they identify that the stakeholders were the patients themselves, the family and caregivers of the patient, because they're also worried about their loved ones. And then it's the clinicians and the pharmacy who are taking care of the patient. They are also involved in patient adherence of the prescription medication. And then lastly, the health insurance and health systems are also involved because they want the patient to take their medications because that reduces cost in the long term for them if they can avoid readmission. So the hospital is much more costlier than the drug itself. So taking all of these in mind, you can create a solution to help all of these stakeholders, and then that way improve your value proposition. So now that the problem has been broken down, we want to build up a solution. Next. And here's a document from the toolkit on a structured way to approach a solution as you first get started. Here you want to identify the beachhead market, who you're really going to propose a solution for, and who's going to buy it. We hand it to early stage startups to clearly visualize the market potential. And so this is an important exercise to do because if there's no one to buy your product, you can't get business. And so looking at this worksheet, which you guys have access to, let's start to fill it in for POPAC. Next slide. So looking at POPAC specifically, we can, after everything we've discussed, we can start to fill in some of these questions that the goal is to improve the experience of patients managing multiple prescriptions. And specifically, it's more in detail that we want to tackle 20 to 40-year-olds with chronic conditions because those are the people who are early adopters and not change at first. So that's important to know who you're going to really be marketing to. So these people are more willing to try something new, and because they have chronic conditions, they're going to be taking medications regularly. So this, at a glance, is what POPAC identified. Next. So next we want to look at the current solutions out there and how POPAC compares against how POPAC can iterate further. So let's look at how others tackled the problem of prescription adherence. Next. One such case is flow caps. This solution placed caps on the prescription bottle and it got to take the medication, which is a great idea, but people tended to lose the caps. So that made it harder for people to take their medications because they were losing the caps, and people were not fully engaged with it after. They might have tried it for a couple of times, but after losing it, they would go back to it. And the next company we're going to look at is MITHM, which is a sophisticated prescription tracking tool that reminds the patient, the family, and even the clinician if a dose was missed. And this is a good idea, but it's an extra step that people have to take. So if they already have a hard time keeping up with their medications, it's just an added step to also kind of track what you're doing and putting it into an app. And then not only that, but sometimes that false alarms to caregivers. So people would take their medications, but they just didn't have time to register it into their app, and then their caregiver or clinician would also alert it, which also was redundant. And then lastly, the solution doesn't take into account older patients who are not as tech savvy. So a lot of older patients who take medication are not going to really use the app regularly, so it doesn't take that into consideration. Next. So what did PillPack do? PillPack decided to create their own pharmacy and distribution. And this way, patients were mailed their prescription monthly, and each box had a ticker tape prescription that you unroll. And once you unroll it, you see a date and time stamp of when you're supposed to take it. So you take it at that time, you know you've taken it because you discarded the packaging, and you no longer have to deal with medication bottles, multiple medication bottles. All your medications are in one pack, and there's no apps to manage, and there's no running to the pharmacy to keep up with your supply of medications because it's automatically sent to you. So these simple steps helped people adhere to their regulations. Next. And it was so successful that Amazon decided to acquire PillPack for $1 billion. So acquiring PillPack helped Amazon to start their pharmacy mailing system. So PillPack kind of created the ground, the foundation, and Amazon went kind of with it. So this is one of the success stories that we covered.
Okay. So that was an overall introduction to the design process, big design thinking, and then an excellent example of what we'll be doing for the next 2 days in picking a problem and stepping through that design process, one worksheet and one step at a time to kind of build up. And that way you can all apply each of these individual lessons and practice on them, and then apply them to anything else because it really is a generalizable system. So our goals for this workshop are today we kind of went through an introduction of it all, but we're going to focus on a problem and breaking it down. Sometimes finding the right problem can be a lot harder than finding a solution. The solution isn't until step 3, or building it up really isn't until step 3. Picking the right problem that's not too broad or too narrow and that really captures a need is harder than it sounds. There are a lot of problems today to be solved. So today we're going to focus on the problem. And then between today and tomorrow evening, we're going to ask you to do some research on the problem you found. Market research is really important. You don't want to pick a problem that's already really been solved by another company or is really crowded with a lot of other companies trying to get their solutions. You want to understand what the atmosphere is around the problem that you were trying to solve. And then we're going to use all of that information tomorrow to build up and focus on solutions. And how does business modeling work? What should we be thinking of as we build solutions and as we work around our problem to present it nicely, to get funding, to move it forward in a strategic way? So the overall goals for the next 2 days are to learn the hacking or the design thinking process, get familiar with these business concepts, and then apply it to change healthcare or to change whatever field you are working in any number of different ways. Apply it to the businesses you all already have and are working on starting up. Apply it to new problems you think of. Apply each of the processes within each problem you encounter. There's really no end of ways you can use what we're going to go through over the next 2 days. So we do know that all of you already have your own companies. which is amazing. We got a list of what the topics all are that you're working on, and they're fantastic and super technical, and I'm sure you would understand a lot of the details of what you're doing. But we're going to take a step back for the next 2 days and ask you to pick a new problem. So you probably know the ins and outs of your solution that you're working on currently, but sometimes that can give you blinders or a very narrow view on things you haven't really thought of. So to kind of get you out of that box and take the bigger picture view, we're going to ask you to think of a problem within COVID-19. It's a huge space and it's a big problem for the entire world. So it's wonderful that you can all sit in the room together and work together. Benjamin and I and the MIT Hacking Medicine team were initially supposed to come over and give a in-person hackathon, which we look forward to doing at some point in the future, but we are still confined to our homes and we can't even be together. So it's really a big problem still around the world. You know, Taiwan is doing a bit better after the United States. So that's the problem. Within that problem, pick any sub-problem or more specific problem that you'd like to address for the next 2 days. It can be very COVID-19 disease specific, whether it's building a new diagnostic for testing, a new drug for treatment, a new process for hospitals to use to onboard or take care of patients when they're overloaded. You can think of something for related patients. Maybe hospitals aren't a lot of different things. You can also pick a problem that has nothing to do with the disease or the virus itself, but has to do with the new normal. How do we educate students if we're all at home? How can concerts or large social gatherings, sporting events still happen safely? There's really any number of problems within the COVID-19 scenario. So we're going to ask you all to get into teams of at least 3 to 7 groups for assessment and pick a problem within COVID-19. So now that we've had this bit of an introduction, before we get into the actual workshop part, I just want to make sure you all have your worksheets in front of you. So we provided some MIT Hacking Medicine template guides for you all to work on, and we'll show them on the screen for anyone live streaming or joining virtually. But also, you don't need to write on those worksheets if you don't want to. If there are whiteboards, if there are sticky notes, if you just want to talk through ideas or have a whole bunch of scrap paper in front of you, because I'm thinking it's not confined to a single piece of paper. Do it however works best. Sometimes the messier the better, and creative ideas are these better solutions. So we have worksheets as a guide. The questions are all really just meant as a guide to get you thinking in the right direction, not the right things. So use the worksheets if you want to use questions. If not, go write on boards, go diagrams, and whatever seems to be the easiest way for you and your team to go through each of these steps. So we're going to get into step 0 now, but we did leave 5 minutes for a break if you need to start the bathroom or get water or arrange in between or whatever. Rearrange your seats. So we're going to take a 5-minute break here and let everybody kind of settle. Yep. And then reorganize into teams. And Michael or Angela or Sam, is everybody already in a team currently, or do some people still need to join teams?
I think everybody is here now.
Well, I think we need to organize.
What need to organize?
We need to get into teams.
Oh, wonderful. Okay. So in that case, since we do have an extra 5 minutes, talk to everybody, and we want to find a diverse team. So I know a few people are already working together in companies. Maybe want to break up for this workshop and work with different people to get some more diverse perspectives. You're going to be working on a different problem, so you might as well make some new friends, network a little bit. So you have 5 minutes to take a break, and then another 5 minutes to walk around the room and meet your people and just pick a team of diverse background interests, technical abilities, whoever seems fun. So we will be back on at, let's say, 8:50, and then everybody should have a seat by 8:50. That sounds good. And we'll get started on step 0.
Thank you, Sydney.
Okay, did everybody hear that? We're going to get into teams.
So we're gonna break into five teams, 5 people per team, and you will practice to think because we're learning methodology, the method. So don't bring your product, just bring your product in.
So, and because the teams should be diverse, you want to break up from the teams that you normally are
Work with,
in,
yeah.
and each separate out into different teams.
You might get something from working with other people. Realize, hey, these people can be my customers too. Or hey, I have a new channel. So that's actually the beauty of this practice. First, think of something when if COVID-19 stays, maybe your business will be totally changed too. It will not be stable. It will not continue where it is. So you really want to think inside different box. And this practice is making you thinking in different box.
Teams of 5 people.
5 people. So you can start looking. If you just come here by yourself, it's easy in a way. The Bruce, you already one. Just in time. So you 3 have to break down. Break up. Yeah. You will have to be different groups. Okay? 所以每个同学请加入另外一组，不要跟你自己的人混在一起。都可以拍照啊，拍照没错。不用大家去把这个拍照，没有，可以拍照。或者是你啊，我们等下到拍完再或者是如果后面那一自己解释来聊清楚。你要不要加入他们？这边有2个帅哥吗？
早上才刚遇到而已。1、2、3、4、5、一个简报，刚好一起。然后你要把我们日常的地方打出来。
对，所以不能是同一个公司的要打散。好像听到有愉悦的感觉，愉悦的声音。那名字你们找一个，你要加入他们吗 ？OK， 就是金融专家跟黑人专家，好，另外一个。多一个嘛。
就别讲就好了。你是剩90块，他是刚好反过来写。
那就可以，可以的。
好。
再讲什么？
你说8奖，他就想走了。
原本是30块，剩的10块，他就可以给我加贵。他知道我们公司要这样子，其实应该会。然后
我根本想不到。
所以我们不能
好，分开。被发现了。
所以你们待会可能每一组都会需要一个白板。然后我们开始会发东西给你们，你们到时候可以用白板或者什么来做事。我们今天特别准备了很多白板。
那边好不好？这边坐。
这边肯定要。
他们待会自己到前面去好了，在前面自己画画好了。好啊，好啊，对啊，去找白板画。对啊。
They will need to find it.
What's the timeline?
We start at 50, 50. 8:50, yeah, 50, yeah.
2 minutes.
Yes, this is a break time. Now we just form in groups.
Okay.
And starting at 8:50, Sydney will start the process of defining the problem. So we're going to work on that. Define the problem.
Okay. So we're going to hear some talk.
Some instruction.
And then we're going to.
Yeah, basically we're going to be, they will guide us to work on that.
Okay.
If you need some crackers or tea.
对，也可以用，对。
Yeah, where's the hot water?
Oh, that's right.
Okay, when you said you stop.
Today I had 2 Last time I thought I slept well, but today I was just sleeping all day. I always say, if that happens, I need more exercise. That's probably the problem. I didn't have too much.
Should we quarantine ourselves? Yeah.
Oh, you think so?
Yeah. Why don't we
I don't think I'll observe. I think I'll just observe all of it. I don't think I'll.
光你可以参加哪一个？哦，好意思。She can't make it. Yeah, so she has to. Tomorrow Jai's turn. No.
Yeah, this kind of packaging is
I think they're gonna start with
Yeah, 50.
Wow, actually,
Those are
You like that?
Is that good for you?
He's still floating.
Yeah, you're right.
He's still a boy.
Growth hacking, right? Don't they call it growth hacking?
Growth hacking, yeah, that's right. Okay. Yes, we're back. We're here. Yes, we actually now have 1, 2, 3, 4 groups, right? 5.
Okay, so this part of the workshop is going to be a bit of us guiding and presenting, and then we'll give you time to do the work yourself. If we're talking the whole time, it doesn't give a whole lot of time for you will all actually think of ideas and apply the process. So since we are over here in the States, you have your absolutely amazing ETA team on the ground, your RTAs, your mentors, and your go-to for questions and help, and they definitely know what they're doing. So we're going to put forward the worksheets that you should also have in front of you. Feel free to ask them if you have any questions. They're going to come around and ask you and maybe challenge some of what you guys are thinking about, just to guide the discussion a bit. We'll kind of go step at a time, and then we'll stop talking for a bit and give you a break to actually do the work and think through the problems, and then we'll recollect and go through what we did on the worksheet and move forward from there. So that's how this next part will work today, and how a lot of tomorrow is going to work as well. You can feel free to come up and talk to us on the camera and the computer as well. But you have a lovely team on the ground there that helps you if you have any questions or whatnot. So the next 20 minutes, and it seems like a long time for one page, but it really is not, is to define the problem. So we kind of give you an overarching topic, and you can sort of mention related. But now it is your team's going to come up with a specific problem definition. We have a few examples at the bottom of this page, at the bottom of your worksheet, from how to get to an overarching topic to a specific problem definition. Feel free to start with 6 or 7 and then narrow in on what you think might be better. Or maybe you have one particular story that might be to choose problem and make you notice if you just want to dive right in. Think when you're making your problem statement now how not to make it too entirely broad that it can encompass so many different solutions. That is obviously unreasonable to focus on, and not too narrow that you're really boxing yourself into a really, really limited customer stakeholder space. So it's a bit of balancing act to get a problem definition that kind of hits the sweet spot of encompassing enough material and information or problem to give you plenty of space to work with things to find an innovative solution, but not too much space to ignore and maybe just get thrown out with everything else on the market and lost it. So with that, we are going to give you until about 9:15, 9:20, and then we're going to ask each team if they could let us know what their problem statement is. So for the rest of the time, we can kind of call you out, maybe one-on-one, and have us give some answers to questions going forward. Does anybody have any questions about defining the problem, especially yours? I'll say silence as an excellent explanation on my part, and you don't know what to say. So go ahead and work with your team. Honestly, this is not a contest. Nobody wins at the end. So talk to other teams too. Maybe people work on different problems. So feel free to peek in on other groups, see what they're working on, and try to find your own problem space. And going forward, we'll ask you to kind of look in on other groups as well, just to get examples of different customers, different stakeholders, different things you might not be thinking of. The goal of the workshop is to come out with a diverse perspective, so the more people you can talk to, the better. And it's wonderful that we can cover your own. So we don't need to worry about something. But go ahead and start.
So you will start defining the question. For example.
对，这样就比较好。
对，因为这边是主镜头，所以其实我一开始是讲说就是朝这个方向照大家，然后这边是后面是简报，简报
不用看，对，不用看，还这样好。
那这个就变放在那前面，还有直接照。对啊，记住这样的位置啊，明天他就照这样。
哦，好，
这样就简单了。
对。好，谢谢。
If people had better proof that the mask was protecting them, they would be more likely to wear it. So the problem is, if people don't know, they don't feel sure this mask is Still, in fact, there was some news published yesterday that shows
我超想换喇叭的，因为实在很小。
如果现在讨论就是，
对啊，
你先把它开起来。
然后去外面讲话。这个是放哪边？
不用，直接先把它。
应该不用。你直接有那个 link 就可以。
它这来的啊。
我刚有 有没接到？
If you use the wrong material for a mask,
对，它自动会切割了。
好，那 Vita 可以进来了。
so there's a lot of people feel there's not too many
That's okay. Just
Just keep
generate.
quiet.
Well, just
Generate
So
ideas.
maybe the problem is
That's maybe ideas.
that's people's feeling, right? Maybe there is proof of the problem.
Yeah, throw flowers and write it down.
That
Yeah.
you're not sure that the mask.
哦，它是把麦克风切过来，但是它喇叭没有切过来。
So maybe the problem is how to convince people
Yeah.
that the mask
Wow,
will
everything is
help.
It's over this one. We gotta join them.
Or how to define what kind of materials are for a mask. So definitely going to be. There's some problems. There's a lot of problems with masks. People wearing or not wearing. They also have this problem too. I've heard, you know.
这样子，这样子。现在
They have enough.
可以啊。
This is also
现在可以听得到吗？
because the U.S. is gonna, you know, like buy
它现在都关掉了。
哎，我叫他开啊，对吧？没有，完全没
Another
有。
problem
你有
is
你有 call in 吗？你是
some people don't like to wear the mask because maybe for work or something.
是叫 Jackie 的没有，
So
因
if there
为
was a
毕了
mask that could let you see this is the person's mouth, you know, this could be maybe more people would wear masks.
关掉了。
好，我再看。
It's getting in the way of.
一条这个 workshop 是英文的吗？
No。
So that's just
那他就要找一个翻译呀。
something related to business. I think we'll
OK， 好，我们开了。
你得找个翻译或者做事。
因为它刚喇叭是有点，对，所以可能要切另外一个。
是没错，他开了。
没有，他可以讲英中文，那你就跟他找一个英文。
那我连接到了，
或是找家里的。
因为他当时就说针对是台湾市，因为他们本来就是。
Because more people will be online, right?
讲的是
你现在不要接收到。
Yes， 你再继续讲话。
不是，你跟大家说现在还不错
要用 hand free 做。
好，开始这个。
然后等一下我们切另外一个产品。
Voice control. Really have a problem.
没有，没有。哎，请继续讲话。继续讲话。
那边 OK 吗？
好，有。
所以是要选这个。
OK 吗？
对啊，好。
没有，那是在这边听，你看到
然后，哎，等一下，你继续讲，我去后面听。
Only you.
maybe 他放在边。
现在是更难。
1、2、3，1、2、3。
Some people say that
1、2、3，1、2、3。
I've heard this argument this way.
测试1、2、3，1、2、3。
大声。
这样听得清楚吗？
这是最大声吗？对，应该最大声。我觉得比较好，我觉得比较好。OK， 这样大声。
I don't think so. Maybe.
因为没关系，他们中文就中文。
没关系，我们先问问看。对啊，那你觉得？我觉得 OK。
Challenge is how to study it.
差很多。
他都听到他自己。
对。
听到我在讲话，我也有听到你声音。
好。
So we have 5 problems.
So we had a workshop. And then we might have. I think I would like to do a. No, we can do it here. Anyway.
看久会累，会晕，一直转会晕。
So the problem there is drinking alcohol that can kill you.
当你以后如果说要在家看的话，那就带上一个，然后就这样走，你就不用再花了东西。那如果说你搭配那个未来式的那个 Space 未来式那切的那一个，你可以直接用手 对，因为它前面2颗胶，然后左右，它侦测你的手势，然后它有几个基本控制手势，然后可以在那边测。就虚拟头可以不要虚拟头来求，用公司有一台。不是因为我们有跟他们在搭配，跟他搭配，还有跟中华电信，我们有合作在这个，所以我们之前。我们现在有一组它的中资类似在做课程。
他可以延长啊！哎呀，是我在想说，我们家这些团队啊。
One of the problems we know is, you know, the social media platforms, they have to try to control like false information, you know, bad information. Yeah.
对，然后又在就是又在那边，然后所有人都看得到。
Publishing of bad advice.
这就是 after 我们的 session， 然后他们就可以接下去。No. So 5 to 6, right? So we have a social work.
I've heard it varies by place. Yeah, it varies.
Then we can also哇，好可怕哦 ！You can rest. I can Nina and Jerry. 哇！你需要帮忙的，不用。但是
Well, there's a lot of problems.
some are negative.
No. These are all.
It's okay. I mean,
Well, welcome to my world. Yeah, 2 weeks ago that's what happened. So we can actually do that real easy.
okay, if people want to do it.
Oh, manage your employees. Or what they said. Yeah, that should be. There should be some problem.
反正是我们在就是会讲的时候就可以让他们练习。如果他们愿意练。
There's also the problem of foreign travel and coming to a country and then and knowing where they've traveled and judging their risk profile.
And I win, and
Maybe they can't say
oh, and I
travel through a bad place, or they travel by plane with people
I'm
that
quite happy. And I really just now
Well, how long?
pretty long. For 9 hours is fine. They only need to do. I don't think that many people. I just did a free touring session, right? So you say if I just want to show us in private, I can get Nina and Jerry No. So that's at least the most.
So that's more like information. I'm saying it's not like we need a machine about it. It's more like
No, the only.
So what's the problem?
Oh.
When you talk, you know, there's
应该是在小吧，他们会听到你机场，然后一直So you will have to laugh at someone else.
Okay. It's essential. Yeah. It's essential purpose is.
要不然就不要在这里了。你不可以在里面不要来啊？对，因为这一楼他就会，其他都会停掉吧？不行啊。除非你其他的 team 放在里面吧，然后到这边来，旁边有咖啡店嘛， 或者周边不是在对吧？就把它们放进去。也无所谓啊，我就把它有点像包场。我坦白说，我钱都在花了，我已经不在乎。啊？
那个空间就会空出来。
可以啊，可以啊。对，那声音得干的，不要。然后里面那个小房间，看你在这个，那就不要回去，因为这样子，不是因为这样就不回去了，就不要拉到那边去啊，在还是在台北去然后。我们现在基本上2-3间。那如果是在林口，就一定是要拉到楼上，楼上有房间吗？楼上有房间。对啊，可以啊。然后中间那边你可以放10个在那边，那就是把它可以啊，好不好？好啊，可以啊。我们还是在林口嘛。啊，不要一单，要卖一单，是好。对，可以。
In America, we never wear masks. Even if someone's sick, we just wear masks. Yeah. Maybe we can think of like a simpler problem. How often should I change my mask? Yeah, I agree. The first one that you had. Yeah, it's not as good. I really thought the first one you I actually thought about like doing the same. Because there's a lot of money to make Yes, exactly. So the best thing is to spit it out now. Because you can get the original ones also too. Many different colors of masks. Yeah. And what if those are like yeah, no, I kind of like if your mask you kind of promote something that you care about, you know. Take pride. There's a candy bar in the US called Or maybe it just promotes something you care about. Right? There, I said cake pie. Imagine and you have like the gay stripe, yeah, there you go, the stripe mask, yeah. What do you think? Had like one, yeah. Yeah, because like thought, oh, I want to keep this, I want to use it, right? In America, they love like their football team, like their British football team, right? So they have their logo on the barbecue chicken flavor. Well, cheese flavor, yeah, but it's not real cheese. Yeah. make it represent something, promote something that they care about. You're a spy. You're promoting. Yeah, especially in America, but Japan also. I heard it's Spence. I heard that people are bad about
We got too many problems. It's almost impossible to nail down.
One of my Japanese friends told me though that, because I told her, I'm like, oh, I can't believe these Americans that they say like, no one can tell me what to put on my body, you know, this kind of thing. And she was like, oh, we have them in Japan too. She said, I've seen a lot like this. And yeah, so, yeah, Japanese but anyways, yeah, so that's
A lot of stuff before that, cars out, we always need to operate to get around. But the problem is we need to get around in the existing environment, so we need to find a way to touch those common items and still can operate. Like how would you rotate doors without
I still think this. I think it's an interesting problem of people who are just coming to your country and determining what their physical requirements are. So let's suppose that somebody traveled, for example, they were in like basically they were in a safe country one day, and then they were in two dangerous countries another day, and then they came here. Versus someone who like is in a safe country, a dangerous and a safe country. You need some way to quantify the risk. And someone who is in 3 dangerous countries in a row, they're going to be the most. So you need some way to decide, okay, do we quarantine this person or not? You know, do you just quarantine everyone, or do you say, okay, this guy was really safe, so he's only in these 2 really safe countries, and nobody on the airplane was from any dangerous country, so he doesn't have to quarantine.
It's like maybe,
you know,
and then they have to go share.
So you can go to the operate, touch anything without having to physically really touch. It's kind of like I don't know, whole body comfort.
Yeah, but you know there's a problem where it takes 3 days.
You might have virus on it.
What did you hear over there? That's got
They
that
are
on
trying
the
to solve a problem that 外国人都会
Okay, what else? Like in the US?
Yeah.
It's impossible to replace all the avoidance. Right. We need to find a way to propagate it. Basically.
All of that, right?
Yeah, like why can't at least have like a clear area? Probably everything you can think of right now, someone has done this kind of mask because your mouth. Oh yeah, well that's like, yeah, what we use that's for food service. Like, could be like that, materials.
That's what they don't have ideas.
They don't have any idea.
Yeah, you have to push this. Let's say you have 10 minutes left.
我记得这样很差一号，你去搜寻才可以看到，就是是一个。
So we were thinking, well, for Americans, like, you know, they usually have a favorite football team, you have a mask against your football team, you go on it, then you're kind of like, you know, promoting your team. Yeah. Right.
对，比较重视的，消费是靠的，就算招聘，我把那个10万人。
How about you? What's your idea? What's your project?
Overarching problem.
The overarching problem is what you think.
For us? Oh, I'm thinking about it.
Sorry, I got to express in Chinese.
So, like, yeah, when they were so isolated or so sad and by themselves. So how do we?
You mean if they say, they talk about personal rights?
But it's one direction. Why somebody
This is where, like, you know, different culture, different forms of government.
No, but still, it's a problem. This is a difficult problem. Definition. My scenario is like people who are quarantined during the COVID-19 period. Even people who are
You're wearing the mask and you're promoting something that you care about. It's kind of like wearing your team.
Maybe even anxious.
It may not work, it may not work, but it's what
All the mental stress, especially with isolation and like that.
They say that God
Yeah, co-working gift. Kitty do too. Kitty actually have more issues. Yeah, there's one kitty that
Okay, so we should be back on.
I think I feel that they have the same challenge. They might have the same They feel like universally.
Oh, really? What is the problem?
But it might come with different solutions.
That's true.
Like in English, they have the same problem. Right?
Does everybody have a problem now?
Yes.
We have a lot of problems.
Well, you have to pick up one. That's manageable within 2 days. I think we have people who have problems and people who have too many problems. They will try. They have to try to come up, narrow it down, clear it
A lot of
down.
us have too many problems. Can we get each of the groups to give us one or a few of maybe their top one or top 2 problem statements, just so we can hear what everybody's thinking about?
Yeah. 1 or 2. Yeah, very good.
Okay, so
we will have group teams to share your 1 or top 2 problems. If you have more than 1, just choose a top 2. So every team has to vote.
and you have to speak into the mic.
You can just talk any now. Yeah.
I wish.
Okay. So we have 1 team. Yeah.
Hello, I'm Vincent. Hi. I want to share our what problem we focus. That is, as we know, in the maybe US or EU or Europe, people don't want to wear mask. And the problem is that people don't wear the mask So what if more than 75% of people wear the mask? The COVID-19 problem will be much easier. So the problem is this, and we want to find out how to encourage people to wear a mask every day.
That is an excellent problem. That's, yes.
So you have 5 minutes to work on new problems. Right. So, do you have anything to share? Okay, great.
Hi there, my name is Chen Yan-chong. During the COVID pandemic, we know there are many people who are in quarantine and been isolated in hospital or at home. So what they care about maybe is not their family, maybe they care about their pets. So we want to, our problem definition is to create a service or to care those people who are in quarantine, to care, take care their pets. Walk them or feed them, play with them. Yeah, that's it.
For our group, the problem that we came up with was the problem of education. So a lot of people maybe don't know how to take care of themselves, and there's just a lot of ways, other countries have done well, but maybe the U.S. people don't usually wear face masks because they just don't know that it's going to be beneficial to them. So for our group, we chose how to educate people to not spread the virus.
Great.
Okay. Well, we definitely need 5 more minutes.
Okay.
That covers all of our problems.
Otherwise, you might come up with different solutions. You might have the same problem.
We have the same problem, but we have the same method.
So Sydney, the fourth group has the same problem as the first group. And the question is whether they should come up with a new problem or they each come up with different solutions.
You are welcome to keep the same problem and try to come up with different solutions.
Okay, there you go.
Yeah, that's definitely a big problem. Plenty of room for more than one solution. And if you came over to the U.S. tomorrow, it would be wonderful if you got people wearing their masks.
Yeah, sure.
So maybe we have many solutions for the problem.
Many solutions for one problem. Okay, that's good.
Yeah, you're welcome to keep the same problem for now. If you think of something else later or can go in a different direction, we'll stay on it and try to find different solutions that work for you.
Okay.
Great.
Okay, so now that we all have a problem, not more than one problem, we'll go forward into step 1, breaking your problem down. So Fatima went through in the case study, and before that in a little bit more detail, what you want to consider for your stakeholders and what their concerns are, and then what do they want to see in a solution. So from that, who do you think your stakeholders are? Obviously, the entire population who would like to get back to some semblance of normality, but a lot of us don't want to wear masks to make that happen. So you have a lot of stakeholders there. All of these have a lot of stakeholders: the health system, patients, the support doctors. So your next task as your team is to try to fill out your break it down step 1 form or put it on videos or whatever. Definitely talk to other teams as you're thinking and see what stakeholders you might be missing. Or what different concerns, maybe one stakeholder has 4 different concerns or 4 different needs. It doesn't need to be a one-to-one in each of these categories. So we are going to use small, about 9:35, maybe close to sort of 9:40 to break your problem down, and then we'll get back together and we'll listen to some of who you've identified as your stakeholders and what they're concerned on, and what they would like to see in solution. And remember, you're not thinking of your solution right now. You're still on your process, breaking the process down. We're not quite ready for a solution.
Okay.
Okay.
So I would encourage you to work on the whiteboard because you just talk, write it down, and then or use the sticky notes.
Yeah, write it down on the.
Yeah, and then you go and you discuss. That's much more efficient. Yeah, that's much more efficient. So these two teams, you can use these two whiteboards, and these two teams, you can use these whiteboards. Okay, much easier to work on ideas. Okay, and also make sure they don't see you.
No, of course you can see.
They're not competitors.
No, they're not competitors.
They have their own community. Okay?
Well, she said the team can talk amongst each other. You can send spies.
Send spies. 便条纸也有。然后你们自己写的便条纸要怎么？Yeah, okay. So there are all kinds of stakeholders. So you have to decide who are the stakeholders, and what are their main concerns, what do they need. Now you can vote.
Well, so I think the idea is you can brainstorm.
Yeah, brainstorm. So you can go with your stakeholders.
Yeah.
现在这个是没有投票。对啊，对啊，没关系。好，我准备推过去。有给自己可以 brainstorm， 计划就这样写，计划书就这样写。打在这广告上，这几个
如果要把名字放进去，名字的那个应该怎么说？你现在里面要印东西，把它把
你们肯定要被想的再多一点，因为你现在讲的是不戴口罩，戴口罩有 patient 跟 people，
看他们的培训这个学校是啥的。
问题他不知道他有病。
maybe.
在clinical 定义上他没有病哦。不是。在 clinical 定义上他没有病，因为他没有病，就像台湾说我就没有艾滋病，因为我没有怎么样，懂我意思吗？所以他不是 patient 哦。
You're just giving them massive.
不是，你还是会有 patient， 然后你会有 patient 的 relative family， 或是对 government very good， 因为 government 是。所以你现在重新思考一下你的想法。你现在努力戴口罩可以是怎样？食衣住行娱乐。
I mean, if I could get a mask that has like an Apple logo on it, I'd probably just wear it.
Apple logo. Apple logo.
I don't think you have to change to wear them. So I think the logo definitely would pay, I think, for at least for the mask, maybe more.
还有一些游乐园做的这个。
Should be fine. Yeah, especially the first ones that would do this. You want to do this good, right, on these things? stakeholders. Yeah. So that's like the person wearing the mask. Playground.
我不讲话，你选。
Daycare.
I know, it is fun. Wow, this team is
Because their problem has been
are they trying to come up with an problem?
Yes.
Oh, well, no, they're saying it's their freedom whether they put something on their body or not. Yeah. Not to breathe. Not have to do. I think that's 35. Right. So, what if we run advertising? You know, if we run advertising, it's just for people who wear the mask, for them to like go and say why they wear it.
You have only 3 minutes left. We have to go
Yeah, okay, social organization.
可以往至少写1、2个出来。
I think it's straight across. Like, who's the key stakeholder? What's their concern? What do they need?
What do they need?
I think it's one line.
Yeah, exactly. So the hospital, what is their concern? What do they feel? And what do they need?
Too many patients have
马上查一下。
怎么了？开始讲后面了啊？后面可以啊。They're gonna use the back.
你们要用背后吗？
我想用背后，你突然间赶快说要重要，就都会错的地方。
我要用吗？要用吗？不用
啊，你也是要想啊。
可以解释就好了。还有其他。
就是要想一个 key stakeholder and think of one. Define one problem. What are their concerns? What are they need? Some feeling or what?
大家对 COVID education， 然后有个 education 会想要戴口罩，可能会想要就是不一样嘛，对，不一样，大体一下，对，这两种打架。
Worry. 你说会戴个戴着口罩之后是有症状。
People wearing masks and people not wearing
应
masks.
该这样说，如果他没有戴口罩。
Yeah, because if you're someone
他
wearing a
他对
mask,
没有戴口罩这件事为什么？
you're not wearing a mask.
People don't wear masks.
People who do wear masks sort of don't want to have you around them. They can't go to school.
不是，你每一个行要是一个他的 concern。对不起，因为游戏规则有点，所以 for healthy people。 他的 concern 是如果没有人不戴口罩，
Don't need to face students.
No student.
Give free masks out to people, shoppers, and like as long as they're wearing your Walmart mask in the Walmart store and they buy something, they get
不是我们现在的游戏规则，你这样会影响到 your Okay, let's go back to that.
It's some pointing because they have points. 他的肯定是
Hospital frustrated. 应该说对不戴口罩这件事情。
不是要这件事情，他的 exactly the word.
Put a brand on the mask.
But what does that mean? Hospitals, they're
Exactly.
I think it's just because like there's too many
No,
patients.
所以
So they're frustrated and see.
因为他扛射，所以他不是戴口罩。
但他们到底是干嘛？专门在简单的
不会，yes and no，因为你有两群人，不是所有人都不戴口罩，你还是有一群戴口罩。所以戴口罩，他希望别人戴口罩，他对于别人戴口罩。他也是有理，可是有一群人反对戴口罩，所以他 people who don't want to wear masks, people who want to wear masks. The healthy people who want to wear masks don't wear masks. What are their concerns? Because they don't wear masks.
very wide. Very wide.
谢谢中文没问题。
What's their concern? What do they need? Not really
We need more time. We need more time. SOS, we need more time.
13 minutes more. 对别人不愿意戴。
怎么样教导他人不要犯这个疾病？但是他们 stay home 教育。怎么像是？我这怎么为什么没有？
See, we have a problem here. Since companies like to have their own group, they will define their own, like if they have the stakeholder, but they say, oh, maybe we are not so care about this. We want to accept other things. Is that okay?
Where is the CDC?
I know.
What's everybody doing with this one?
马上都把这边想成是厂，不是人。
对，应该是。
government officer 对不对？
Do we have any volunteers that want to hear some of their stakeholders or concerns?
And they're still working on it. We don't even know. I don't see the CDC.
Since they're still working on that now, we probably really need a few more minutes.
Yeah, that could be one.
Okay, that's fine.
至少我们办一两个。
So amusement park, how do you educate? I don't know. Their main goal is not to educate people, right? That's how I feel. Yeah.
，people that have
they need a higher percentage of certain problems. Okay.
生态相关的。
So you might be able to
I think it just
somebody else.
if there's like characters in the movie, like, those would be the people that are the problem.
第三块没写啊，至少要写一块。
所以我们现在针对一个他们没有问题，然后我们认同。
You can do that. I mean, you can do this too. And there will be other stakeholders as well. But it makes more sense to do doctors and maybe some people.
They need a reason to wear the mask.
但是你从台湾的角度想，我如果从美国角度讲，就绝对是错误的。是。这个我先不用，我先这个刚刚讲 ，so they don't want to wear that because they are afraid of the virus.
Key opinion leaders.
The main thing is 他们现在是 reason why they don't wear that.
这种都是就是很会，就是很影响力很大的。
我觉得你帮我们
因为我们把它想成哪里地方啊，可那地方也在教人，其实教人，应该是现在就是教育啊，身份的人，我觉得是 teacher 的老师可以教。
Maybe we just focus on these three.
Teachers.
need to feel bad there.
School teachers. School teachers. What's their concern?
So
how about in Europe?
So this is for the brand holder. They need promotion.
Is it like
they need to
teaching
know
the
that
patients
people are wearing the mask. They need to know that they put their logo and pay for masks that people will.
Do they wear masks in Europe?
They do, they don't. Yeah, why? So the thing is that you can just like.
So this is not really prevention. It's more like they already got it. We're taking it.
Understand their feelings. If they're ideal customers, you have to.
Let's go to the next
Oh,
part.
go to the shop, they will ask their questions and observe and read. Exactly.
And their concern is their
Anyway, let's assume it's American. Let's assume it's how to make American warehouse. So how about, if that's the case, if people read you as a culture, give me some friends they can identify.
Like being a
Say
good
for example, will they wear big masks? Yeah. You have to help. You cannot just say, oh, pass it What do they need? What do they need? What do they need? For the people Captain America mask.
Alright, how are we doing on step 1 now?
Well, I think
Okay, let's keep going. Okay. Anyway, it's not gonna be perfect.
So, coming back and adding more, as you can see.
So this is
There's
hard.
a lot of discussion, so I'm trying to keep it perfect. Alright, so does anyone have any creating stakeholders or photographers concerns that they want to share?
Yes, we have one team. We actually several teams. We have the first team sharing. Nah.
Maybe this is like taking care of pictures. Okay.
What is the camera that they're looking for?
Can we zoom in on
They
it?
can come in. They can come to the front.
Are they able to zoom in or no?
Can I turn this camera or?
Which one? Oh.
Okay.
Is it easier to see that?
Here comes the.
Here comes the general.
Here comes the general.
Okay, great job. Can you see that? Can you see that?
That's Sydney.
Sydney, can you see the screen? Okay.
Yeah.
Oh, wonderful.
So it's awesome. Do we have any wants to share real quick, or will we go on to step 2?
Yeah, you can be the next one.
Okay, so we have another team to share their homework, their work.
卡座位啦，座位卡卡一下，一共我一共卡卡重
我们要先，我们先创
都可以都可以。
Okay, first,
先讲。
okay, first, I think our pet care, the stakeholder in our pet care business is first is the owner.
There's a microphone there. Wait a minute.
不是后面那个，对对对。
后面桌子，后面桌子。
Stephen, do you want to come to join us? Okay.
Hi everyone. And in our pet care business, I think the first stakeholder is the owner of the pet, and the second is the pet and their family, the owner's family, because they may not want to take care of the pet. And then is the insurance and the service provider. And their concern for the pets is first is hungry, because they will be hungry if no one feeds them, and they need a company. So they need a company, so they will feel lonely if no one play with him. And they need medical care, and they need to work outside or exercise, and they need house cleaning and cosmetic service. And so in the end, we will provide food, a company, and medicine, or the service will come, including cleaner, or pet shop, or pet hospital. Okay. Any?
Very thorough. Alright, so awesome. You can always come back and keep thinking through your problem and adding more to any of the remaining steps. And while you think about it more overnight, our last very quick kind of activity today, our worksheet we'll go through is building it out. So what we're going to do is we'll spend a really short amount of time on this today, because tonight or tomorrow you might be able to do some research on your problem a little bit more. And then tomorrow evening again, we'll take another look at this exact same sheet and ask you to kind of go back and review and update it with things you've learned. So we're going to spend like 5 minutes on it today, just so you've seen it and you've thought about it, and it will help guide some of your research and your thinking through tomorrow. And then tomorrow we'll take another look at the exact same thing and see where we can improve. So I'll give you really only 5 minutes here. 5 minutes to take a quick look at this. You don't need it all filled out. We won't go over it yet. We'll save that for tomorrow. But go ahead and take a look at step 2 and put down some initial thoughts.
So are we working on that?
Yes, 5 minutes.
5 minutes to work on
Yeah,
that.
5 minutes.
Yeah, okay. So you want to start building based on your problem, and then the stakeholders and their concern and their need, to write down the basically exactly summary. Am I understanding correctly? So this is the exact summary what you're gonna do. Your goal is to improve the quality of access to all that. So try to work on it. Right? Good job. Very good.
We're talking about number 4.
So let's work on build it up.
So you found that actually it's harder than you think to define stakeholders. And also, what are their true concerns? And what do they really need? It's not as easy. Well, I'm telling people who have illness. Really? Who are the true stakeholders? It's so good. Right?
Or are we targeting the ones who already went past the social factor.
always thinking it's holiday recognition,
走到后面去，走到后面去。再能走完就已经过5分钟了。
没有，我们是要走，我们3分钟。
I've heard that you can buy them. It's just,
TV or media. It's not a big one. Those are probably ways of like proper just broad, you know, like access to information and TV, media.
trying to give them a little more motivation.
Maybe just go broad first.
它一个是这是 YouTube， 这个是
对啊，就放过来挺效果。
I think quality of information and access to it, you can have like a really well-written or very well-written commercial. And then access to it.
还是说他预设对不对？就是上面
所以他开始想那个上面那个问题喽。How going to whose quality of what access to what?
Okay, right.
其实大家都很喜欢用自己的表单往下发展。
You can change it later.
比较像自己的时候。
对，这个就是怎么去得到这些资讯。我怎么去看影片，或是可以 television
social media.
不要啦！那我们直接写下一个，我们想写什么就写什么。
So we're making like a media business is very media creates information and sends it out to social media, give it to doctors, give it to hospitals. Is that what we're doing? Oh yeah, yes, I was thinking about that. Yeah, right. Target customers. Want to help, yeah. So the first customer we want to focus on. Yeah, more of those people. Sound like protesting, people going out protesting. So we can target protesters. That might be fun.
They suffer from.
Alright, how is everybody doing with step 2?
Too fast.
Okay. Super quick. Alright, so you don't use the all finished, we will take another look at it.
So Cindy, they are all over, they're so all excited about their discussion, so you have to give us 1 minute to, so what, do you want somebody to share their answer or what?
We'll save this for tomorrow. So tomorrow we'll take another look, and then we'll have you share their answers tomorrow for this.
Okay, great.
Yeah. So we'll wrap that up really quickly. So that was really quick. When you actually get to really nice.
I think they also start from.
So today is just an overview of us at 4 sectors. MIT has embedded
Security of freedom.
Together we went through finding our problem and ways to so tomorrow, we are going to get totally out in the center. And as you're thinking about your problem, now that you have a problem, it would be great if you can think about good design. I know it's a little early because you only have the problem, but as you kind of brainstorm overnight and into tomorrow, think of what solutions you're coming up with. So a specific need of a cost to reach out to users. There's a lot of ways in each step that you kind of incorporate each of these quickly principles to come up with the best.
They can improve their health by paying people to
So for tomorrow, we would love if everybody could do the patient journey worksheet. That's your packet worksheet.
Yeah, protest leaders. Improve their health by educating the protest
leaders. Patient part and kind of fill it in with whatever is your problem. Not everybody's problem is with patients or healthcare. So go ahead and change around the words to make it fit kind of the process of what your problem is. And do a lot of research on your problem. Know if other people have started to make up solutions. Maybe your problem is already solved, but you don't know about it. You kind of pick a new problem. And then start by thinking about who in your step one, your customer care, your stakeholders, you know it. Maybe you can talk to them and see what their needs are specifically instead of thinking about what their needs are. You can just ask. You know, so that's a lot for 24 hours. Give you enough to think about for tomorrow and have it get ready. So, with that, it is almost 10 o'clock at night your time. So, I know I'm on time. But we asked, can you guys use your team on the ground and use your round of applause for helping mom and getting this set up?
Thank you.
Thank you.
So thank you guys all there for listening and anyone listening virtually. And we will see you again, same time, same place tomorrow. With that, and feel free to reach out to us. The DTA team has archived information. If there's anything if you have any questions or like to get in touch with Catherine or myself in the meantime, you are more than welcome to. But in any case, have a wonderful rest of the night, and we will see you all tomorrow for part 2.
Wonderful. Thank
Wonderful.
you. Thank you. Thank you. See you tomorrow.
So also to remind everybody, you might define your problem and then go home, think about the patient's journey or their needs, and then you come out and say, hey, maybe I should define my problem differently, or my stakeholders, or I zoom into one stakeholder. So you might keep going back to it and define it, and then come up with something. So you have homeworks too from the patient.